We had agreements from the Taliban Ministry of Health that cash payments to hospitals could pass through the ICRC and did not need to pass through Taliban authorities, which allowed us to have agreement from donors that we would be allowed as ICRC, an independent organization, to pay salaries to some of the staff. We have always paid salaries. Let's not forget that most of these medical doctors, nurses, operators of water systems and electricity systems are still the same people. It's the leadership which has changed, but not these people. The problem that in the vision of the international community today is that if a crisis is emerging, humanitarians will fix it. But humanitarians haven't been here to fix an implosion of a whole country. What humanitarian organizations can do is cushion and parts of crises for a certain time. And I think the really important issue is to find an agreement on a sufficient injection of liquidity, which is possible without necessarily recognizing formally and internationally a government. People who don't get enough food will get sick. If the health system is not able to deal with the fragility of health, then this is again a problem. So I'm concerned about the interconnectivity of the food, health, water, sanitation, electricity, and educational system. We didn't have to knock the doors 20 times to get access again to prison. It was a critical issue which I raised with Mullah Baradar when I met him beginning of September. I think in our conversation it was clear that access wouldn't happen in the days after the coming into force of the Afghan government, but it has happened in between, and I think it's a testimony also of the trust that probably exists in some of the Talibans who have been visited by ICRC when they were detainees before.